This conference will now be recorded.
And I want to know that if anyone has any query from yesterday's task. Because I found that some of you shared a letter, so still there were some mistakes. The thing which I want to explain it now is the, yeah, please tell me.
Regarding the date pattern, actually, is it okay that the pattern of the date we can write it in a number, and it means that means I wrote the date
Number is
27.
not fine. For example, you have written 26/5/2021, then it is not correct. You have to write 26 May 2021. For the month, you have to write in words.
Okay. What about the date of birth and the admission date? We
Date
have
of birth, you
to
can
maintain
write
the
same like that. Again, month you will never write the month in the numbers. It will always be in the words. Either it is admission date or a discharge date or any date. Okay?
Okay.
Okay, yes, tell me if anybody has any further queries.
Yes, ma'am. Ma'am, where do we supposed to put comma, ma'am, after the figure or before the year, ma'am?
After in the date you're asking me when you write the date?
Yes, ma'am. Yes, ma'am.
Okay, so it will be after the month, but it is not that important. If you will not put, it's okay. If you just write 26 May 2021, it is okay. And if you're writing 26 May, comma 2021, that is also okay. Yes, Gursimran, you have any questions, dear?
No, ma'am.
Okay. So,
Hello.
Yes, Romy.
I have one question. I'm always confused writing from the second paragraph just after introductions because I'm not able to understand how should I start because I wrote few later and even I'm just forwarded you two later and both later I'm doing a same mistake all the time.
So I guess I've given you the corrections that how to start.
Yeah.
Yeah, so follow that. Okay. All right. So always remember start the paragraph, first paragraph, especially with the patient name. Okay, I'm gonna share the screen, and I believe you might have written. Now, this is yesterday's task. Why I want to discuss this, I just want to tell the common mistake which everybody did is, I always say one thing, it is not about this task, it is about every other task which we have done. When you know that in intro, your purpose is the patient requires short-term emergency accommodation. And second assistance is support services. You should always, please fix in this your mind. This is for all the new joinees and for everyone. Please write it down in the capital words. Always explain your purpose. जो भी आपका purpose है, अगर मेरा purpose ये है कि इस patient को ये stage चाहिए, तो I should explain that in the first paragraph. First paragraph will always be explanation of the purpose. My purpose is short-term emergency accommodation, then I need to write in the first paragraph कि उसको short-term accommodation क्यों चाहिए? And if I will write a medical history in the first para, examiner will not read your letter further. That is absolutely wrong. That means you did not understand the task. You don't know the organization. Okay, so answer when you write a letter. After that, ask yourself that my purpose is this. Have I explained that in the first para? Now, so I have explained, I have to, because she need a short-term accommodation, and this problem is related to the social life because nobody is with her. She is unemployed. She is not working. No one is there. There's no home where she can go and live, and that is why. So that, and moreover, let me tell this very clearly in Hindi and in English as well. जब आप लिखते हो socially she is a single, come on, everybody is educated. You are writing this to directors, you are writing it to anyone, to whom anyone you are writing, they all are educated person. If I will tell I am a single, this is understood that I am talking about my social life. उसमें ये लिखने की जरूरत नहीं है कि socially this, in terms of the past medical history, patient has diabetes. If you will write the patient has diabetes, has had diabetes for past 10 years, I understood that this is the past medical history. You don't need to tell me in terms of past medical history. These all are wrong words. Please don't use that. Write straight way, point to point. You will understand this when you will start working in UK. You will be so busy, you will not have any time. And you then you will understand that I don't have that much time to, write a long stories. So please be very specific from point to point. No need to write socially. Start directly. Miss Ray is a single and she is unemployed or whatever she has been living. So like write all that problems. Now second paragraph you said you have a problem in starting. So there is no problem if you will start second para with the name also, no problem. Start with the patient name. That gives the more clarity. And if there is a second purpose is given, like here it is a support services, then it is good to explain why the patient needs support services in the second para. I hope this letter is clear with everyone. Yes? So those who have done mistakes, I have already given the corrections. Please rewrite the letters. So Davinder, Gursimran, I did not get letter from you. I understand this is the first time, but you can look at the sample and you can try to write. At least try. Okay?
Yes, ma'am.
So today I'm going to explain you that what are the things you guys need to keep in mind that will help you to understand in a better way. Okay? Now look at this. As Jasmine, you requested, so I'm gonna cover this part. That what are the things, guys? You can mute from your side. I can hear the sounds of the dogs. Yes, thank you. So if you have any query, you can unmute yourself and can ask. Okay, so this is just to explain you that how to make sentences. That is what we are going to focus on today's task. So I'm gonna give you the steps and I want you all to make some notes out of this. So please keep your pen and paper ready and note down the point. The first one is the moment, this is what I explained yesterday also, the moment you get the paper in your hand, the first thing that you have to do in 5 minutes, read the task carefully. Okay, be very specific with the information. Who am I? First question. Second, to whom I'm writing. Third, why I'm writing. Fourth, the type of letter. You should have answer of all this thing in that 5 minutes. You should be clear with all these questions. And then interpret the case notes correctly. You need to interpret it that, okay, I'm writing this, you're reading, and you have to see, okay, I have to write, and this is what, okay, like, understanding the case notes. So that is what is interpreting. Now, third point, select relevant case notes. Then you have to select. So we'll go with this one by one, that how you have to select the case notes. Then fourth step is transform case notes accurately and organize your writing logically. So if you will follow these steps, you can write a very good letter and you can easily get 400 plus. Okay. So if you will practice from your first day, it will be good for you, because no experiments are allowed on the day of test. Okay. All right. So as I said, we will go step by step. I said read the task carefully. It means during that 5 minutes, you have to read it very carefully. Now, let's say it is written here. You have to go directly to the case notes, that using the information in the case notes, write a letter to Miss Mantha Bruin, who is a senior nurse at Greyvals Nursing Home, who will be responsible for Mr. Baker's continued care at the nursing home. Now, you guys will tell me what is the type of letter. First of all, I want to know what is the type of this letter. From everyone, Gursimran, what is the type of letter?
Known case.
This is a known case. Why do you think this is a known case? How do you understand? How do you pick up this thing that this is a known case? कैसे पता चला ये known है, unknown है, ये कैसे पता चलेगा? How? Anybody can explain? Romi? Come on, there are foreign people, explain me. Just me?
Mr. Baker's continued care at the nursing home.
Okay. Yeah, continued care is the purpose. The patients require continued care. This is the purpose, right?
Who will be the responsible for Baker's, Miss Baker's?
Quite close to the answer. Okay, so I'll give a simple clue. Whenever, guys, please mute. Okay, thank you. So whenever there is a post of comma with the name and written S, post of comma S, continued care. Mr. Baker's, remember Mr. Baker's continued care. Right? Then it is a very clear-cut indication that it is, there will be two things. Either a word back will be written, who is back to the nursing home. Okay, back means वो वापस जा रहा है, तो वो, and second option, post of comma S will be there. Like it is written Mr. Baker's continued care. So that means he's living there, and this is a known case. I hope you will remember these two things.
Can you explain once again?
I said this post of comma S, Mr. Baker's continued care. The first, there are two things to recognize. First, either a word back will be written, that is back to the nursing home, or this Mr. Baker's post of comma, Mr. Baker's continued care. When we use this post of comma, when the things are mine, so that means I am locating there.
I did not get what you're telling. Post of?
Post of comma. It is written Mr. Baker's continued care.
Post of comma. Okay. Fine. Thank you.
That's what I'm saying.
Sorry.
Who will be responsible for Mr. Baker's continued care at the nursing home? Okay. So this is how you can recognize that this is a known case. Fine. Now I got this is a known case. That means it is a which letter? Which letter if it is a known case?
Discharge letter.
Yeah, it is a discharge letter. Thank you so much. So it is a discharge letter. Okay. Now, usually the task provide you all the information like recipient's name, who the person is, his profession, workplace and address. You can match the address as well. No, like in the further summary of the task, patient address will be given. So you will see you're writing this letter to the Bruin Samantha Bruin. Her address and patient address is same. That is the way to select. Okay. So this is what that information you should have during this time. Okay. All right. Now, second step is interpreting the case notes correctly. Now, this is very important, that how do you interpret the case notes? Now, for example, to whom you are writing, why you are writing, you should be very clear with your purpose. Purpose should be very clear. If you understood the purpose in a wrong way, the whole letter will be wrong. Okay, so you have to keep in this mind that you always read it carefully, and you understood, interpreted it. I always say that once you read the task, write it like a flow chart. Okay, so this is the patient admitted on this date, underwent surgery, this, and 2 days later he was shifted. All right, so make a flow chart. Okay, this is what happened. Now he has this problem, and that's why he needs this. It will take only 1 minute for the flow chart. And believe me, the students, those who have scored high, some of my students have scored even A, they always say that, after 5 minutes, when they, during that 40 minutes, rest of the 40 minutes, they don't start writing directly. They take 10 minutes more. They read it carefully again and again. They, they make a plan that how to write the intro. They make a flow chart to understand the task and is not missing anything. And once it is done, you know what you have to write. Then it is not that difficult. It takes then only 15 minutes to write the letter. Okay, so interpret it, make a flow chart of the letter. Okay, this date patient, this date this happened, this date this happened. Okay, after 2 days this, after 4 days this, and now the patient is ready to discharge. Okay, makes sense. First understand yourself and then try to write. For example, now sometimes you will see the case notes will be written in a short ungrammatical phrase. Not sometime, it is always. Like it is written nursing management and progress. It is written daily dressing surgery incision site. Now, can you interpret what it means? What it means? Can you interpret it?
She
What it
requires
means?
daily
Dressing
dressing.
surgery incision site.
That patient requires daily dressing in his in surgery site.
This is a nursing management and progress, means during the hospitalization. So that means this daily dressing was done in the hospital.
Yes.
Yes? So you have to make a complete sentence. So if you will understood that like that this has to be done after discharge, and you will write after discharge this has to be done, and you missed it to write that during the hospitalization it was done. So that is called correctly interpretation. Please read it carefully. The heading is nursing management and progress during the stay. Right? Is that clear?
Yes. Yes.
Ma'am. Yes, ma'am.
Okay. Now, we'll take another example. Sometimes they give abbreviations. For example, social worker organized 2-week WK, 2-week hire of worker. What do you understood by this, and how can you make a sentence? So what do you understood by this, that social worker organized 2-week hire of worker?
Oh, it's already
That
arranged.
means the patient is not
Arranged for 2 weeks more.
Organized, which verb it is? That's what is interpretation of the case notes correctly. Organized is which
Past.
verb? Past, second verb.
Yeah.
It is already organized. So how can you make a different sentence from it? Romy, I want to hear from you. Can you make a correct sentence for this?
Yeah. I think Willy Walker to be organized by the social worker.
To be organized. What it means to be organized? To be organized means future में उसको करना है. To be organized. But यहाँ तो लिखा है social worker organized. Already organized. So how
Then
you can write
we
this?
can, yeah, social worker
Mm-hmm. Mm-hmm.
either Willy Walker organized by the social worker.
Yeah, you can write, make a passive of it. A walker is arranged or is organized by a social worker or has organized. Social worker has organized a walker for 2 weeks.
Yeah, Willy Walker organized by social worker.
Yeah. By social worker is not, for 2 weeks, WEEKS. You have to write a full form. Please interpret the case notes correctly. That's what is I'm trying to say. Let's take another example, because sometimes, now this is a variation, sometimes they give some abbreviation and sometimes they give a symbol. Symbols are very important. I mentioned that in yesterday's class also, कि जहां भी symbols होगा आपको वो sentence बनाना ही बनाना है. Either there is a hyphen or arrow on upside or on the low side. Make sure अगर कोई भी symbol है वहां पे question mark, even question mark, you have to make a sentence for that. It's very, very important to make a sentence. Now, since it is written, eyesight decrease. Now, decrease due to cataract removed 16 months ago. Now, how should I interpret it? It decreases now or already decreased?
Already
Tell me.
decreased.
Already decreased, ma'am.
Already.
Alrighty. Salumpi, are you there?
Removed.
There is due to.
Yeah, tell me.
Mode 16 months already done.
16 months
Get
ago.
mode already.
It's already passed,
Okay.
removed, second worker.
Surgery done
Yeah.
ago.
Yeah, surgery was done 16 months ago. And now his eyesight decreased because of cataract surgery? Is this the interpretation? Yes. Now, what I understood from you guys, that you guys are saying that his surgery, his cataract surgery was done 16 months ago, and now his eyesight has decreased.
But
Is this the meaning?
mostly I can say after the
Eyesight.
cataract, the eyesight like vision is going to increase if until unless any complication.
Don't apply your own knowledge. Go as per it is written. यहीं पे गड़बड़ होता है जब हम आई बिलीव आई फील अपना माइंड नहीं चलाना है, जो लिखा है उसी को एक्सप्लेन करना है. अब मैं सोचूं कि नहीं कैटरेक्ट सर्जरी हो चुकी है 16 मंथ्स अगो, उसके बाद तो आईसाइट बढ़नी चाहिए, शायद एरो गलत डाल दिया, सिंबल ही गलत डाल दिया, ये गलत है, एंड आई विल राइट इंक्रीज्ड. दैट इज रॉन्ग. डोंट assume. So tell me what is written as per that, what is your understanding?
Okay.
Due to decreased
now he is already.
One by one, because I'm not able to understand then what you guys are saying. Yes. Yes,
Actually,
come on.
it's complete past, ma'am. It's
Yeah, it is a
complete
past
past,
medical
ma'am.
history.
It's a past medical
Yeah,
history. Now
it's a past
it's a
medical
complete
history.
past. So it's now he doesn't have any problem in the eye. From my knowledge, I think.
Okay. Yeah, this is a past medical history, not the current. Yeah. Subheading is very, very important.
Ma'am,
Past
is it
medical
like
history.
Due
ma'am,
to decreased eyes, he had a
is it
cataract
like due
surgery
to
16
decrease
months
of
ago.
eyesight
Okay.
due
So,
to cataract? Her
uh-huh.
cataract has
Uh-huh. Okay. So
her
like now
eyesight
somebody
has
said
reduced.
has reduced due to cataract surgery, which was done 16 months ago. But
Yes.
heading is past medical history. Please be very conscious with the subheading as well. It's a past, not a current problem. It is not at all a current problem. This is a past medical history that due to cataract surgery, eyesight decreased due to cataracts removed 16 months ago. So cataract surgery was done 16 months ago, and because of that, his eyesight has decreased. This is a past problem 16 months ago. Now, I'm not talking about relevant information or irrelevant information. This information could be irrelevant if it is not related to the eye problem. But I'm talking about the symbol. So whenever the symbols are given, you must use it.
JASLEEN ma'am,
Yeah.
eyesight can be used like eye vision.
Yes, you must write vision, not eye vision. Vision is eye vision only. No need to write eye
Yeah.
vision, vision only.
Okay. Like if I can make a sentence, vision is decreased because of the cataract surgery.
Yeah. 16 months ago.
Vision is
Yes.
decreased because of the cataract surgery, which was
Vision
done
is
16
decreased.
months
Is
ago.
नहीं होगा ना? Past medical history है तो is नहीं आएगा.
It means vision was decreased
His
because of
vision
the
was
cataract
decreased.
surgery.
Yeah.
Vision was
Yes.
decreased because of the cataract surgery, which has been done 16 months ago.
Why has been? Has been कब use होता है?
I think in the continuous, maybe.
Ah.
No.
Yeah.
Passive.
When we use has been? Come
Present.
on, anyone?
I have no idea.
Okay.
Present
Has been
perfect.
we use. Yes, it is a present
Present
perfect tense.
start from the past
Okay.
and now
Passive.
continue.
Excellent. So something in the past and still continued. Let's say I am living in America for last 10 years and I'm living now, even now. Then I can say I have been living in US for past 10 years. Something in the
That
past
which sentence you are
still
going to use?
continued. That is has been. Okay.
Okay. All right. Thank you.
Okay. All right. So this is how it's a past medical history. His his vision reduced due to his cataract surgery, which was done 16 months ago. This is a complex sentence, which I'm saying. You can write in the simple way as well. Okay, so this is like whenever the symbols, please make sure you use. Now, fourth example, which I'm gonna share is it is very important that you take care of the subheading or a category. For example, you compare these two case notes. It is written past medical history hernia, admission diagnosis hernia. Now, what you understood by these two statements?
Sorry, once again, please.
As it is written here, you can see, I hope everybody can see the screen.
Yes.
Yeah,
Yes.
admission diagnosis hernia,
Past
and the
medical
past
history
medical
hernia.
history is hernia.
Yes. So what is your understanding?
Past medical history hernia. If I can just again applying the down, there is an important difference between the hernia means and the past
Don't
medical
read that.
history.
You tell me
Okay.
what is the difference?
Maybe a patient was already like a past medical hernia history, but Now on admission, maybe past medical history already had a hernia, but on
Okay, let me
admissions
hear from
again.
Devinder. Devinder, tell me आपको क्या समझ आया इससे? पास्ट मेडिकल हिस्ट्री हर्निया, एडमिशन डायग्नोसिस हर्निया, इससे क्या समझ आता है?
Past medical history hernia means already patient has hernia. For there
In
was
the past.
hernia. Yeah, in the past maybe patient had hernia and maybe is treated by medically and came with the same complaint.
Very good. Now this is how you understood. अगर आपने pick सही किया, then you can write a very good letter. But if you understood it in a wrong way, you will write a wrong letter. So interpretation of case notes is very important. He might have hernia in the past and the symptom has, worsened now, or let's say it was treated earlier and again he has hernia. So it depends on your understanding how you interpret the case notes. Is that clear to everyone? So your interpretation of case notes is very, very important. Please remember that. All right, we'll move to the next topic, selecting relevant case notes. Now, this is very important. You know that letter has to be only 180 to 200 words. So you cannot simply just write everything. You have to be very careful. So what you have to do, you will choose the relevant. This is what we talked yesterday. Keep in mind who you are. Very important. You are a nurse and you are writing to whom and why. This whom and why, if you will keep in mind all the times when you read every line of your task, you can easily select the case notes. We will take an example for this, okay? We'll discuss one letter on this. So coming to the next point, organize case notes logically and coherently. Now this is the next step after the transforming the case notes. Before that, you need to organize that. Okay, so this is what I'm going to write in a first para. This is my second para. This is my third para. So you have to decide it based on the whom you're writing and based on the purpose. And never mix two ideas together in the first paragraph. The first paragraph should have a single theme. If you're writing about the current problem, then you will write all the current problems. Never mix present problem with the past medical problem or with the social. First paragraph, you will always write the current problem. In second paragraph, you can mix past plus social. You can mix, but not in first. Please note down the golden rules of thumb rules which are fixed. You will never start first paragraph from the past medical history. Second, you will never mix two ideas in the first paragraph. Okay, should always have a single theme. So take some 2 minutes, 3 minutes, or even 5 minutes to plan your letter. Take that, spend some time. That if what is most important for this issue, what is the secondary issue? These three answers you should have when you plan, when you organize your letter, and what else does the reader need to know? You should have these three things. So please note down while planning. You should ask yourself, what is the most important issue? So you will write the main issue in the first para. What is the secondary issue that you will write in the second para? And what else the reader needs to know that you can mention it later on. Okay. All right, so we are moving to the next one, which is transforming the case notes. Now, this is very, very important. So be very careful. I hope everybody is awake. Nobody is sleeping.
No.
Great. Good to know that. Okay, now let me make it very clear that grammatical mistake, let's say there are 6-7 mistake, 20% marks depends on the grammar accuracy. So you have to be very careful. This 20% is really important. That can increase your overall grade. It can take you from C plus to B. It can take you from C to C plus. So sentences, tenses, very, very careful. Okay. Now, it is always between a subject and verb agreement. So I'm giving you here the 3 examples are given. This 3 will have, if you will change the verb, this will have a different meaning. Now let's read the first one. It says, Mr. Baker experiences migraines. Can you tell me which tense it is? Mr. Baker
Simple
experiences
present.
migraine. Simple present. Very good. What it means, what
Simple
you
present.
understood from this? It is simple present, but what you understand, Mr. Baker experiences migraines, what it means?
She feels she has
Now,
migraine. Now she has migraine.
now
She's
she
experiencing.
has.
Regularly he is
Hmm.
getting.
Sorry?
Regularly he is getting migraine, still continuing.
Okay. Anyone else? If somebody asks your daily routine, what is your daily routine? What are your regular problems? If somebody asks me, what is your regular problem? I will say, I experience migraine very often, or I experience migraine. We always describe the daily problems in the simple present tense. Now, when I write in a bracket, it is clearly written regularly. That means I get it very often, very frequent, on a daily, on a regular basis. Not on a daily, but on a regular basis. Now, it doesn't mean that I have a headache now. Are you getting me?
Yes.
Yes,
Yes,
ma'am.
ma'am.
Okay, I wake up daily at 5 a.m. मैं रोज 5 बजे उठती हूँ. Doesn't mean that now even I just woke up. No. It is not necessary that I have a migraine now if I'm writing Mr. Baker experiences migraines. This is a regular problem of the patient. Is that clear to everyone?
Yes, ma'am.
So this will change the meaning. Please keep this in mind. We use in which I ask you to use simple present tense for the social life. When you describe the patient's social life, always use simple present tense. And when you write, when patient take any regular medication, I told this, if you remember, regular medication. Regular means take on a daily basis. So always use simple present tense for that. Okay, coming to the second, as there is some noise, can you just mute it? Mr. Baker experienced migraines. What it means?
In the past, he had migraine.
In the past.
This is a past tense,
It
simple
is
past
complete
tense.
past.
Experienced, yes, it is a simple past tense. Experienced migraines. That means now he doesn't have, but he had an episode of migraine. So if I have to rewrite this, I have to rephrase this tense. How can I write? Mr. Baker experienced migraines. Can you rephrase this sentence? Because you don't have to copy in the same way.
Mr.
कैसे लिख
Migraine
Baker
सकते
was
हो?
had migraine.
experienced by Baker.
Mm-hmm.
Mr.
It is
Baker
always
had
I
Mr.
think Mr.
Baker.
episode of
Baker,
migraine.
Yes. Okay.
Mr. Baker experienced episodes of migraine.
Yeah. Okay. Experienced migraines. Mr. Baker had an episodes of migraine. Had.
Yes.
Simple past we can change to past perfect. Simple present we can change to present perfect. Okay?
Can you tell me
Mr.
again?
Baker,
Can you explain
yeah,
the
simple
simple
present tense you can change to present perfect, and
present
past
perfect?
you can
Okay.
make to the past perfect.
Simple past to past perfect. Okay, ma'am.
If it is given like this, you can easily make past perfect. But if it is just written, had an episode of migraine, past medical history, then you have to make simple past tense. If there is no tense
Yes.
given, then you have to make simple past tense only in the letter. Okay? Now the
Okay,
last
ma'am.
one is Mr. Baker is experiencing migraines. Experiencing,
Jasleen ma'am.
yes.
Jasleen ma'am, on the second, I'm sorry, I'm coming in the second. Can we make a sentence like Mr. Baker was experienced migraine?
Yeah, you can make it past passive. Very good. Okay, now tell me, can you make a past passive for this? Mr. Baker was experienced migraines. Can you make a past passive? Otherwise, it's very good. If you have something in the simple past, you can make a past passive of that. But can you make a past passive of this sentence? Anyone? It's a very good. Thank you so much for highlighting it, because this is very important thing which everyone, does a common mistake for this.
Mr. Baker was continuously experiencing migraine.
Where it is
Can
written
be?
continuously. No,
No. I'm just making a sentence.
no, that's wrong.
Mr. Baker was experiencing migraine. No.
My question is simple. Can you make a passive sentence of this simple past? Mr. Baker
Yes,
experienced migraines. Can you make a passive for this? Anyone?
Mr. Baker is being experienced migraines. Hello, ma'am.
Hello?
Hello, ma'am.
Is being experienced? Which tense it is? Yeah, which tense it is? You said
Continuous,
is
ma'am.
being experienced. Which tense is that?
It's
No, it is
continuous,
not
ma'am.
continuous.
Yeah, present continuous.
Is being is a present passive.
Present continuous.
Passive form of the
Okay,
present continuous.
let me speak
Passive
now, dear.
present continuous.
Yes, not the continuous. It is called present passive. And my
Yes, ma'am.
sentence is already in the past tense. Then how can you change into a present? If it is written in the past, can you make it to the present?
Which
No,
is
absolutely wrong. You can't make the past tense into the present. Something is in the past already done. He had an episode of migraine. You cannot change into the present passive. That is absolutely wrong. In fact, what I'm trying to say, you cannot make even a past passive form. Mr. Baker was experienced migraine is absolutely wrong.
No,
I can
ma'am.
give you an example. Let me
Ma'am, what
explain.
I'm saying. Okay.
Yeah, tell me.
Ma'am, can we write like Mr. Baker was a patient who experienced migraine?
It's a very long sentence. We never use the word patient.
Okay.
Yes, tell me.
Ma'am, may I make it migraine has been experienced like that? Can I make it this sentence or same? Otherwise, can I make it in same sentence into passive form?
Okay, may I know your name first?
It means make. My name is Nimi, ma'am.
Okay, Nimi. Thank you so much. Now let me tell you. I think now you listen to me because you have a very wrong myth about this. When the tense is in the past, listen it very carefully. When your tense is in the past form, you cannot make into the present form. Past means it is already over. How can you bring your past to the present?
Ma'am, ma'am, are you asking about the last one or second one?
We are still on a second one.
Okay, ma'am. That's why I thought it was in the third. You asked regarding the last one. That's why I told
No,
this one.
Romy actually, okay, no worries. Actually, Romy asked the question on the past tense only, okay? I was answering him for that. Okay, so Romy, let me clarify. Thank you so much for highlighting this question, Romy, because I want to give a clear information to everyone. जो चीजें past में हो गई हैं, हम present में नहीं convert कर सकते. It is impossible. Okay?
That's true.
और जो चीजें अपने आप होती हैं, उसको हम कभी पैसिव नहीं बना सकते. ये याद रखना.
Okay.
The things which you cannot make a passive tense of the sentence which the things done on itself. For example, someone write his wound healed well. Which tense is this? His wound healed well. वूंड अपने आप हील होता है. वूंड हील करने के लिए कुछ चाहिए नहीं. वूंड उसकी अपनी एक प्रोसेस है. वूंड हीलिंग प्रोसेस है. वूंड हीलिंग अपने आप होती है. थर्ड पर्सन आके वूंड हीलिंग नहीं करवा सकता. उसका एक नेचुरल, द थिंग्स विच हैव अ नेचुरल प्रोसेस, you cannot make a passive tense for that. So if you will write his wound was healed, you're making it a past passive. Absolutely wrong. Same way, he experienced. This is a natural process. He experienced. This is the feeling. He experienced this. So you cannot make a passive of this tense. We make, what do you mean by passive? Please understand this, very important. If I told Romy, if I'm talking to you, if I'm teaching to you now, I'm talking, Romy, you do this, Romy, you do that. This is called active information, active sentence. And when Romy will talk about the information, Romy, when you will share my information with the third person, that will be passive conversation. तो नेचुरल हीलिंग प्रोसेस में तो थर्ड है ही नहीं ना, थर्ड पर्सन है ही नहीं, तो वो पैसिव कैसे हो गया? So please remember the things which heals on its own, which have a natural process. You can never make a passive tense for that. Mr. Baker experienced my experience is my experience. This is not I'm sharing my experience with someone. So you cannot make this experience word to the passive. Remember that. I hope this is clear to everyone.
Yes,
ma'am.
Yes, ma'am.
Okay, because this is a very, very common mistake. Most of the students write like his wound was healed. They think we make passive, but that's absolutely wrong. Okay, so past to past, simple past to past perfect to simple past, present to present perfect. Mr. Baker is experiencing migraine is a simple continuous tense. That means currently, now. That is why ing is used here. Okay, so this is very important. Please keep these three different verbs in your mind: regular, past, and currently. If you have to write the current information, you can use continuous. If something patient does on a regular basis, simple present. Something in past, simple past. If you will use these three tense in your letter, you can easily get B.
Okay.
Okay.
Yeah, clear?
Yes, ma'am.
Okay. Now I'll take you to some simple mistakes. I won't say the simple mistake. These are called silly grammar mistakes. I'll show you that. Now, example is given here. It is written pimple versus pimples. What do you mean by this? What is the difference in pimple versus pimples? Pimple is singular, pimples is plural. It's a noun. Yes? Like in yesterday
Yes.
letter, lot of you have done mistake. You are writing that mother and baby both require short-term accommodation. When both are included, then it will be require, not requires. Requires we use for a single person, S or ES, but not with the plural. So same way, you have to be very careful that singular and plural. Okay. Now countable and uncountable. Blood is a countable or uncountable?
Uncountable.
Pimple we can count. Pimple we
Uncountable.
can count. It is uncountable. So you cannot write bloods. This is a very common mistake. Articles. A headache versus the headache. Can you give a clarification on this? A headache
A headache.
versus the headache. Yes. Tell me. He has a headache.
A headache, ma'am.
He has the
A
headache.
headache.
A
A
headache,
headache.
ma'am.
Okay. And when we use the headache, we use the headache also, but when? In which scenario? Okay, let me
If it
explain.
is telling first time,
Yeah. Tell me, yes?
if it is telling first time means we have to mention a headache.
Very good, Nimi. So
Yes,
a
ma'am.
headache is the first time. The
Yes, ma'am.
headache, when he comes second time with the same headache, then you can write the headache. Let's say on the second basis, you can write subsequently, he represented with the headache.
Yes,
But
ma'am.
if I'm writing on a first time, that Mr. X presented to me with the headache. Clear?
Yes.
Okay, now the verbs is given.
Yes, ma'am.
Suffers from versus is suffering from versus has suffered. Can you give me an explanation for this? Suffers from, simple present. Suffering from, continuous, same word, continuous, now.
Continuous.
Suffered from, has suffered,
Past.
Past.
present perfect.
Currently, recent.
Present past. Present perfect.
Yeah.
Present
Passive form of
perfect.
And now this is also a common mistake. Please monitor for anemia. Or he is on medication. Is this correct?
his own medication, correct?
Monitor for anemia. Please monitor him for anemia. Him for anemia.
Him.
For anemia. He is on medication. The better word which you can write, as I told you, on a regular basis, he takes medication.
He takes medication. Okay.
And when you're writing, he was commenced on medication. Okay, now this is a letter format. You have to write the recipient title, full name, profession, clinic name, address, today's date, and then patient name, salutation, introduction, paragraph 1, paragraph 2, paragraph 3, closing phrase you can write, If you have any queries, please do not hesitate to contact me. Then sign off. Yours sincerely, your profession charge nurse. So this is the complete. Please mute at your side. There's background noise. Okay, thank you. I will share this notes in the group. You can take a printout of this and you can keep and read these notes, okay? Okay, so this is about this letter. So let me know if it is clear to you guys. Yes?
Yes.
Yes,
Is
ma'am.
that clear to
Yes,
everyone?
clear, ma'am.
Yes.
Yes,
Yeah?
Yes,
ma'am.
ma'am.
Anybody has any
Yes.
questions?
Yes, ma'am.
JASLEEN,
No,
ma'am.
ma'am.
Yes, tell me.
In the introduction paragraph,
Mm-hmm.
we can start the introduction paragraph. The Miss Ria raised one letter we wrote yesterday. That one, Miss Ria raised and her baby is being referred to your facility for short-term emergency accommodation and support services. She is due for discharge today. That is correct.
Is being referred. Don't make it complex in the starting first sentence. Learn the simple way. Okay, you can write there are two ways to write. Either you can start like I'm writing to refer because this is a referral letter, or you can request directly. I'm writing to request short-term stay for accommodation for Mrs. Ray and her newborn baby. Don't make it complex. Is being referred. You can, but I would advise when you are practicing, don't practice any different way. Don't make it complex. Follow the simple pattern. Our target is to score B, so we will focus on that. All right.
Yes, ma'am. Thank you.
Anyone else has? Gursimran, you have anything in mind to ask me?
No, ma'am.
गुरसिमरन लेटर आना चाहिए कल.
Yes, ma'am.
आज रात ਨੂੰ बैठ के लिखो. कल लिखो but लेटर आना चाहिए. I should get your
Yes,
letter. Fine.
yes, ma'am.
Okay, so I hope now this writing part is clear to everyone and you guys can start writing a letter.
Yes.
And no one, this
Yes,
is for
ma'am.
all the beginners,
Yes, ma'am.
nobody will
Yes, ma'am.
repeat the letter until unless you have to repeat the letter if you're not getting B in your letter. It doesn't matter if one letter you have to write it 10 times, you have to. Don't get irritated or don't get frustrated that, oh, madam again said to rewrite, why I'm not gonna. Please don't do that. You have to be feel motivated. I have students, those who have scored 400 in writing. She wrote her first letter 15 times. 15 times. So it is very clear. It doesn't matter how many letters you write. Most important is, are you getting B in your letters? That is what is important. So you have to keep on writing the same letter until unless I ask you to write next letter. If you're not getting B, if I'm saying it is okay, it's a good letter, you can write the next letter. If I'm saying you have to rewrite, that means you have to rewrite it. Is that clear?
Yes, ma'am.
Is there any
Yes,
problem
ma'am.
in rewriting the letters?
No.
No, ma'am.
Okay. So it is your benefit because I want you to understand from the first letter itself that how to get B. I want you guys to ask me if I have given you C plus, you should ask me that why it is C plus not B. What is the mistake? Okay. Shankdi, it's clear to you, Shank?
Yes, ma'am.
Okay, so I want your repeated letters.
Okay, ma'am. I'll do it, ma'am.
Okay, great. So, any questions for me? No? We can sign off for tonight. Yes, tell me, dear. Delia.
Sorry for the inconvenience. Because can you just tell me how we can start in two ways? I am writing to refer with the race. Other way, I am writing a letter to refer.
Request is also a very good way. Request is also, there are many ways to start. Okay, so since if you're writing, guys, please mute from your side. There's a lot of background noises. Okay, so you can also start with I'm writing to refer, or I'm writing to um, request. You can write the direct patient name. I'm writing to request. Write the purpose clearly. I think request is a better way because this gives a very clear-cut information to the examiner when you write the purpose first. So this is the best way to write. I'm writing to request your urgent assessment. No, anything which is the purpose, you can start directly.
Okay, ma'am.
Okay. So anyone else has any questions in mind? No?
Ma'am, could you
Okay.
please tell me what can I use the other word for lies, because I'm not able to find the other word for lies in this
Lies.
letter.
Lies.
Yes,
What is
ma'am.
lies? I mean, what is the sentence?
Lies with the local maternal health service.
Ah, lies with the local medical contact, engage, and request her to visit. So contact is a better word for that. Kindly
Okay.
contact, make a contact, or kindly engage her, or kindly
Kindly
fix her
arrange,
appointment. Anything, kindly arrange.
kindly arrange for
Okay,
local
ma'am.
maternal health service.
Yeah, you can
Okay.
request in that way.
Thank you, ma'am.
All right. So anyone else has any doubts? No? Okay, so I want to get those who I have given the corrections and I've asked you to rewrite. So please rewrite the letters and send to me.
For tomorrow's letter, you will send it to them.
Yeah, I've already shared in the group. So you can, okay, I'll do one thing. I will share another letter and I want everybody to write the same. Is that okay?
Yes, ma'am.
Okay, I will share one letter now. So, and I want everybody to write. In fact, if you will see the folder which I shared yesterday, there are two tasks in that.
Yes, yes,
Can you write the second task?
yes.
Okay, then we will have a discussion. For everybody, please write the second task of the folder which I shared yesterday. There are two tasks in that. One which we have already discussed yesterday, and there is another task. That's also very important. So you can go through that. All right?
Gerald,
Yes, ma'am.
Okay.
Ma'am,
Good
can you
night.
share once again if you don't mind?
Okay, I'll do that.
Thank you.
All right, thank you guys. Good night and see you all
Thank you,
tomorrow.
ma'am. Thank you so much, ma'am.
Thank you, ma'am.
thank you,
Good
ma'am.
night.
Thank you, ma'am. Thank you, ma'am.
Thank you, ma'am.